Assalamu alaikum. I am Dr. Silvia Paroi, Assistant Professor of Community Medicine Department at the Akij Medical College, Khulna. Today we start Analytical Epidemiology. We have to know the Analytical Epidemiology. Analytical Epidemiology where object is not to formulate but to test hypothesis. In analytical studies comprise two distinct types of observational studies, that one case control study and then cohort study. Importance of this study. From each of these study designs one can determine whether or not a statistical association exists between a disease and a suspected factor, and if one exists, the strength of the association. In case control study, there first select population, then we divide into two groups, case and control. In case control study, time of study proceed forward but its direction of study is backward. In case control study, two groups, case and control. Cohort study, there we first select population. From population we select sample, then sample divide into two groups, exposed group and not exposed group. In cohort study, time of study is forward looking and direction of study also forward looking. Case control study. In case control study, often called retrospective study. Why it is called retrospective study? Because its direction of study is retrospective. The case control method has three distinct features, both exposure and outcome. Outcome means there we mean disease. Disease or any events have occurred before the start of the study. The study proceeds backwards from effect to cause. It uses a control or comparison groups to support or refute an inference. Basic steps of case control study. There are four basic steps in conducting a case control study. First step is selection of case and control, then matching, then measurement of exposure, and last step is analysis and interpretation. Selection of case in study. All criteria we select for case control study. All criteria of selection, the sample as definition of disease are same with disease. This is case in study. And selection of control in study, all criteria of selection, the sample are same but they are absent the disease. In the group of case, they are all criteria same plus disease with disease, and a selection of control group, all criteria of selection are same without disease. Now second step, matching. Matching, supposing we are investigating the relationship between steroid contraceptive and breast cancer. If the women taking these contraceptives were younger than those in the comparison group, they would necessarily be at lower risk of breast cancer, since this disease becomes increasingly common with increasing age. So matching means matching with age, matching with socioeconomical condition, matching all samples, matching with their criteria. This confounding effect of age can be neutralized by matching, so that both the groups have an equal proportion of each age group. Then we go for third step, that measurement of exposure. Information about exposure should be obtained in precisely the same manner both for case and controls. This may be obtained by interviews. by questionnaires or by studying past records of cases such as hospital records, employment records, etc. Now we see the fourth step, that final step is analysis. Final step is analysis to find out exposure rates among case and control to suspected factor, and then estimate disease risk associated with exposure, that is odds ratio. What is exposure rates? A case control study provides a direct estimation of the exposure rates or frequency of exposure to a suspected factor in disease and non-disease groups. And relative risk or risk ratio, which is defined as the ratio between the incidence of disease among exposed persons and incidence among non-exposed. We have to know a typical case control study does not provide incidence rates. In general, the relative risk can be exactly determined only from a cohort study. Now we have to know odds ratio, which is a measure of the strength of the association between risk factor and outcome. Odds ratio is closely related to relative risk. The derivation of odds ratio is based on three assumptions. First, the disease being investigated must be relatively rare. Second, the cases must be representatively of those with the disease. And third, the controls must be representative of those without the disease. Now we see advantage of case control study. Relatively easy to carry out the case control study. Case control study also rapid and inexpensive. It requires comparatively few subjects. Particularly suitable to investigate rare diseases or diseases about which little is known. And in case control study, no risk to subjects. Case control study allows the study of several different etiological factors, such as example smoking, physical activity and personality characteristics in myocardial infarction. Risk factors can be identified. Rational prevention and control programs can be established. No attrition problems, because case control studies do not require follow-up of individuals into the future. In case control study, ethical problems also minimum. Now we see disadvantage of case control study. In case control study, problems of bias relies on memory or past records, the accuracy of which may be uncertain. So there is some bias. Selection of an appropriate control group may be difficult. And thirdly, we cannot measure incidence and can only estimate the relative risk. And fourth, in case control study, do not distinguish between causes and associated factors. Not suited to the evaluation of therapy or prophylaxis of disease. Another major concern is the representativeness of case control. There is also one bias. These all are case control study in my lecture today. Thank you everybody.